Welcome to the Healthy Families New York Program Quality Series. This session is the fourth in a 6-session series that's designed to help you as HFNY providers understand and use quality measures to improve the outcomes of your program. Through this series, you'll learn where specific data are gathered and why, and you'll also learn how tools in the MIS can be used to improve the quality of your program's performance. I'm Margaret Gullick.
And I'm Corinne Noble. We'll be your guide through this material. Before beginning this session, we'd like to remind you of the 3-part series of the basic training, forms training, for newly hired staff and sessions 1, 2, and 3 in this current series on performance targets. All of these sessions are available through YouTube, and you can find the links on the MIS in the Helps and Documents tab under Training Materials. This session is intended primarily for program managers and supervisors. As mentioned in the previous sessions, you're able to view this webinar at your own pace, stop when you want to, replay areas you may want to hear again. The time in which you complete each session is less important than what it is that you learn. So don't feel pressure to learn everything quickly. Feel free to replay areas where you need a better understanding over and over again.
Please have your program's last performance indicators with you. It'll be helpful to you as we discuss the various elements of the report and where those numbers come from. Also, have a copy of the PI details document found among the training materials in the MIS. You can pause the webinar to find these documents. If you're a new program, reviewing the PI details and watching the webinar will be a good introduction, but we recommend you watch it again once you've actually gone through the process and have data.
As a new program, we will be sending your PIs even though at the beginning you won't have many families or data. This will make your numbers look terrible. Not to worry, we know this and are not expecting anything different. The good thing about getting exposed to the PIs early is that you will have time to learn and understand the process and get into the habit of using them to monitor performance. You can expect your numbers to look better after 24 months or so, so please be patient. Let's talk about what we're going to accomplish in session 4. At the end of this session, you, the learner, will be able to understand the biannual performance indicator reporting purpose and process. Identify the reports and timeframes used for each item. Be able to run each of the reports and determine your program's score for each item, and know who to contact for further information. Okay, let's begin.
Performance indicators are run twice a year, in April and October. There are several goals for this process. First, PIs provide a snapshot of program status and performance. How many QPTs do you meet for the past year? How many families are on creative outreach at this point in time? Do all workers have their required trainings? This procedure gives programs a formal opportunity to take stock of their current performance in the measured domains and self-evaluate based on data to supplement more informal impressions of performance based on day-to-day operations. It also creates a deadline for data entry into the MIS, which keeps all programs relatively up to date in their data. You can't get too behind when you're being measured every 6 months. For central administration, PIs are an opportunity to monitor several key items in the best practice standards. CA is required to monitor system-wide performance on many items to ensure statewide implementation quality and adherence to the BPS. These PIs are one way in which CA can determine current performance on some of these items. And finally, PI performance history may be used by OCFS as one factor in making decisions about program expansions or funding.
As Margaret mentioned, PIs are run twice a year in April and October, and the default reporting period is the past 6 months. For the spring cycle, that will be October through March, and for the fall, April through September. At the beginning of each cycle, you will be emailed the performance indicator details by central administration. You can find an example of these details in among the training materials. if you printed a copy for today's training purposes, you will notice that the details include the dates of the reporting period, a description of each of the indicators in the first column, and the name of the report and the date range in the second column. You will also find an explanation on how some of the indicators, such as prenatal enrollment or capacity, are calculated, and the HFNY supervisor observation of FSS's and FRS's policy. You should run each indicator to see where your program stands. Make sure that the start and end date on each of the reports matches the dates required. If data still needs to be entered to MIS, this is the time to do it. MIS data entry is expected to be completed by the 10th of the month. PIs are run mid-month, and you will receive your PI report to review around the 20th of the month.
As you run all the reports in preparation for the PIs, you may find that you do not meet certain items. You should determine whether you think you're eligible for an exemption for any of these items. If you're not sure whether a situation would be eligible for an exemption, you can always consult with your contract manager. Exemptions may be granted for some PIs. We'll go through what's generally required for each of these items as we work through the webinar, but here are some sample exemption situations. For example, for training, an exemption may be given if an individual worker is missing a required training but received a stopgap training in time, or can demonstrate that they received an equivalent training prior to starting at HFNY. That worker would then be given credit for the training in your count. For observations, an exemption may be granted if a worker was on leave for the program for a long period of time and missed several opportunities to be observed. Supervision exemptions are rarely given, as there are some other factors built into the report to only look at weeks when a worker was not on leave. However, there may be some occasional exemptions. If you think you'd be eligible for an exemption, make sure you send that request to your contract manager by the beginning of April or October so it can be reviewed by CA. Note that exemptions are not granted for the remaining PI items. For these indicators, you either meet the requirement or do not meet it. There is no mediation process.
So, let's take a moment to do a knowledge check. Does CA consider exemptions for any of these PIs? For which items can you apply for an exemption? Now, please pause and take a moment to write down your answer, and we will be sharing the answers at the end of this session. Okay, to measure this indicator, the New York State Quarterly Performance Target one, we run the quarterly performance targets for 4 quarters reports. We look at each of the performance targets indicated on the screen, that is, all of the health and development ones, the first parent-child interaction, that is breastfeeding, and 3 in the family life course targets, which are employment, TANF, and referrals for needed services. The expectation is that 9 of those 12 performance targets from the past year are achieved in at least 3 of the 4 quarters. Retention rate at 1 year. The date range will include participants who enrolled 12 to 18 months in the past, because the aim is to see how many participants are still enrolled after a year. We only look at participants who enrolled at least a year ago. In order to get the right number, make sure you run the report after the end date of the period measure is over. If the PI period is in April, you will need to run it after April 1st. If it's the October cycle, you will need to wait until October 1st to run it. The target is to have 50% of those enrolled families still active. Assessment completion. We know the better outcomes are achieved the earlier services are initiated. Efforts should be made to assess families as early as possible. So, if at least 80% of assessments occur prenatally or within 14 days of the baby's birth, the target is met. The first home visit. We know there is a greater likelihood of retaining a family when the alliance between the family support specialist and the parent is formed early, and time is needed to develop a trusting relationship. To meet this target, 95% of the first home visits should occur prenatally or within 3 months of the birth of the baby. Target number 5, required forms. This indicator is required forms, as I mentioned just now. These screens, such as the ASQ3 or the ASQ-SE2, the follow-up, PSIs, to meet this target, forms with invalid entries in the last month should be under 25%. And by invalid, we mean missing, not reviewed by the supervisor, or out of window.
Number 6, accreditation requirements for training. So this next item refers to requirements of training for staff hired in the past 5 years. The orientation trainings, core trainings, or intensive role-specific trainings, shadowing, and family goal plan trainings. Some of these trainings need to occur before the first visit or within a worker's first 6 months in their position. Pay extra attention to when entering trainings into the MIS. A mistake in the code for topics and subtopics can prevent the trainings from showing up in the reports, and the target won't be met. Trainings will show up on your PI reports as X of 4. If all workers have all the trainings they need for each of these 4 categories, you'll get a 4 of 4 and will meet the item. However, if all workers have their orientation, core, and FGP, IFSP trainings on time, but some workers do not meet the shadowing requirements, for example, you'll get a 3 of 4 and will not meet the item. When the PI reports are sent out, you'll also be given a list of which workers do not meet the requirements for each training element, so you can easily see who needs further training or who didn't get their training on time.
Number 7, accreditation requirements for training. We can use the same advice on correct data entry for the wraparound training at 3, 6, and 12 months. They are required for staff hired in the past 5 years, and time is of the essence. Wraparound trainings will show up on your PI report as an X of 3. If all workers have all the trainings they need for each of these 3 categories, you will get a 3 of 3 and will meet the item. However, if all workers have their 3 and 6 months wraparound trainings on time, but some workers never had their 12 months wraparound, for example, you will get a 2 of 3 and will not meet this item.
Number 8, home visit rate. Home visit rate for a program is computed by finding the number of visits each family is expected to receive over the last quarter of the performance period based on the family's level versus the number of visits each family actually received. The New York State target performance is 75%. It is expected that 75% of families will receive at least 75% of their expected visits. So, if at least 75% of families receive at least 75% of their expected visits, you'll meet the target for the item. If less than 75% of families receive 75% of their expected visits, you will not meet the target for this item. The next item is supervisor observations for FSSs and FRSs. All workers are expected to receive regular observations from their supervisor in performing their job. We specifically track observations for assessment workers and home visitors who have been working in the program for at least 1 year. Newer workers are also expected to be observed, but they're not counted for this item until they've been at the program for at least 1 year. Further, by the BPS, program supervisors should also be observed, but they're also not tracked as part of this particular PI item. Here, the expectation for number of observations in a year is based on a worker's type of role. An FSS who only performs home visits is expected to be observed 4 times a year. An FRS who only performs assessments is expected to be observed twice a year. Any worker who does both home visits and assessments is expected to have 2 home visit observations and 1 assessment observation. They need to be observed doing both components over the year. So even if a worker is mostly an FRS and mostly just does assessment, if she performs any home visits in a year, she's expected to have 2 home visit observations. As such, it's very important to keep track of what roles a worker is performing so you can make sure they have all the observations that they need. This item will show up on the PI report as X of Y, where X is the number of workers with sufficient observations, and Y is the total number of eligible workers. If X and Y match, you meet the item. If there are some workers who do not have enough observations and they do not match, you do not meet the item. So how do we count observations to determine whether a worker meets this requirement? First, we need to find all FSSs and FRSs who have been at the program for at least 1 year and done home visits or assessments in the past year. So who needs observations for this item and how many observations of each type do they need? Then we count how many eligible observations of each type a worker has had. Note that only 1 observation per type per month is counted. So for example, a worker can't just have 2 home visit observations in the same month and have them both count. Only the first one will count. Observations are also expected to be done with different families, so you're not just observing one dynamic each time. Then we determine whether a worker has all the observations they need based on their roles. And again, note that supervisors and program managers aren't included in this count, though by the best practice standards, they do need some observations of their own. So let's take a look at an example. In this situation, let's say our PI period is from October 2016 to September 2017. So that's our past year. We'll look at workers with home visit observations and assessment observations to see who has performed each role in the past year, how many observations they had in that role, and how many observations they needed. So let's look at our 3 workers here. Have they all been around for at least a year? Was their first home visit at least 1 year ago? In this case, yes. The date of first home visit is at least 1 year ago for all 3. Have they all actually performed home visits in the past year? Yes, the date of the last home visit is within the past year for all of them. So first, let's look at Charlotte, our first FSS. How many observations in the past year period does she have? In this case, Charlotte has 3. The last 2 are both in August of 2017. They're in the same month, so only the first one counts. So she has 3 home visit observations. Next, for Georgiana, how many observations does she have in the past year period? Georgiana has 4. And what about for Caroline? In the past year period, from October 2016 through September 2017, Caroline only has 1 home visit observation. Now let's look at assessment observations. Both of our workers have been in the program for at least 1 year, and both have performed assessments in the past year, so they're both eligible here. How many observations do each of them have? Charlotte has 1 observation in the past year, and Caroline doesn't have any. All right, so overall, for our 3 workers at this program, let's see what each of them needs and how many observations of each type they have and whether or not they meet the standards. Charlotte is a dual role worker. She's done both home visits and assessments in the past year, so she needs 2 home visit observations and 1 assessment observation. She has 3 home visit observations and 1 assessment observation, so she meets the requirements. Georgiana's only done home visits in the past year, so she just needs 4 home visit observations, which she has, so she also meets the requirement. Caroline, as you probably noticed, is also dual role. She's done both home visits and temps in the past year, so she needs 2 in 1, but she only has 1 home visit observation and no assessment observations, so she does not meet the standard. So overall, here are the program's numbers. They don't have anyone who's just doing assessments, so they have 0 of 0 FRSs. Their 1 FSS meets the requirement, so they get 1 of 1. And for dual role, there are 2 workers, but only 1 meets the requirements. So of their 3 eligible workers, 2 meet the requirements, so the program gets a 2 of 3, and they don't meet the item.
That was great, Margaret. Let's take a moment to do a knowledge check. Here are 2 scenarios. How many observations does each worker need? And again, we're going to ask you to pause and take a moment to write down your answers, and we will share the answers at the end. So take a look at Willow and Cordelia's, and we go over them at the end.
Number 10, the prenatal enrollment rate. The prenatal enrollment rate for a program is computed by finding the rate for the past 2 quarters. The New York State target is that 65% of participants enrolled in the performance period will have been enrolled prenatally. In the report looking at quarterly program information for 8 quarters, we set our time period to the last quarter. So the last 2 columns are the last 2 quarters, which is our performance period. So of all of the new enrollments for these 2 quarters, what percentage were prenatal? In this case, there were 14 plus 11 new enrollments, and 11 plus 10 were prenatal. So if we do the math out, we see that 21 of 25 new enrollments were prenatal, or 84%, which is just below our target of 85%. So in this case, the program does not meet the item. To note, averaging the 2 percentages, here 79 and 91%, will give you an approximation of whether you meet the target, but the math isn't quite the same. So we do all of the math out, we do the full thing to see if we meet the 85% target. The creative outreach target is that no more than 10% of a program's enrollees will be on creative outreach as of the last quarter of the performance period. So in that same 8-quarter report, we look at whether the percentage of families on level X or creative outreach at the end of the last quarter of the performance period, so the last column, is 10% or less. And here it is, so the program meets the target. Number 12, program capacity. Program capacity examines whether a program has enrolled at least 85% of the families expected by their contract. Contracted capacities are set by OCFS and are related to the number of FSSs a program is contracted for. To note, this item is calculated based on contracted FSSs, not the number actually employed by a program. So if a program is short-staffed and doesn't have as many FSSs as they're contracted to employ, their capacity goal does not change. So let's look at how capacity is calculated. To find capacity performance, we again use the 8-quarter report, and we look at families active at the end of the last 2 quarters, again, our performance period. Let's say a program is contracted for 8 full-time FSSs, or 7 full-time FSSs and 2 half-time FSSs. They would then have a contracted capacity of 160 families. Here, the program has 141 families active at the end of quarter 1 and 145 families active at the end of quarter 2, so an average of 143 families. 143 out of the 160 that they're contracted to have is 89%. So the program is above target, and they make this item. Finally, our last PI is supervision. All staff are expected to receive at least 75% of their scheduled supervisions in the performance period. Let's take a look at how this is calculated. Weekly supervision is a requirement for all staff, but the time required does differ by whether a worker is full or part-time. So full-time staff, 75% to 100% FTEs, are expected to get 90 minutes of supervision every week. Part-time staff, 25 to 75% FTEs, are expected to receive 60 minutes every week. And any staff who are under 25% FTEs are expected to receive 15 minutes every week. So every week for everyone, but the amount of time does differ. Also note that supervisions must be at least 7 days apart to count, because you can't have 2 within the same week, so the MIS wants them spaced out. So you can't do Friday and Monday to catch 2 weeks back to back. Supervisors are required to have supervision as well as part of the best practice standards, but are not counted as part of this PI. Each worker's supervision score is calculated by finding their supervision rate, or the number of weekly supervisions meeting the standard versus the adjusted number of expected supervisions. Workers who get at least 90% of their expected supervisions get a 3. Workers who have 75% to 90% get a 2. And any workers with less than the 75% expected get a 1. If a program has any workers with a 1, they do not meet the item. For example, let's say Donna Moss has her supervisions on a Tuesday. Based on the supervision day, the report will look for the first full week with a Tuesday in the performance period, and it'll make that the start date. The report then looks forward to the end of the period and finds the number of full weeks, here 25. Next, there were 3 weeks where staff out all week was entered as a reason supervision was not held. These weeks are then excused from the count. So now Donna is expected to have 22 supervisions because now there are 22 eligible full weeks where Donna was in. Donna had 17 supervisions, and 17 of 25 minus 3, or 22, is 77%. So she has at least 75%, so she gets a 2 and meets the item. The MIS computes the supervision score for each worker at a program. The program score in the PI report is the lowest score for all staff. So if all workers get a 3, the program gets a 3. If the lowest worker score is a 2, the program gets a 2, which is still great. And if any workers get a 1, the program gets a 1.
Let's take a moment to do a knowledge check again. Here are 2 scenarios. Would each of these workers meet the supervision requirements? Please pause the video, take a moment, write down your answers. We'll go over them at the end of the webinar. So, we've gone through all of the indicators and discussed how they're calculated. Time to finalize the process. Once the exemptions that we discussed earlier are taken care of, CHSR will run the data and email each program their numbers. We call it the first look, but in reality, you had the first look earlier in the month. So you should know what to expect. If you find any mistakes, please contact us right away so that we can correct and rerun your data. But no reruns will be done for missing data. So please make sure that it is in there in the MIS by the 10th of the month. Once any mistakes are taken care of, we send the final report back to the programs, contract managers, and central administration. So let's look at the answers for knowledge check number 1. First, exceptions are not granted for retention rate, home visit rate, or capacity. However, exemptions may be granted for trainings if you can demonstrate that a worker received a stopgap training in time or had received equivalent training before joining your program. Exemptions may be also granted for observations if a worker was out for a long time and did not have enough opportunities to be observed.
Now let's look at the answers for knowledge check 2. First, for Willow. Willow is a dual role worker. She performs both assessments and home visits over the course of the year. Because she does both, she needs 1 assessment observation and 2 home visit observations to meet the standard within the year. For Cordelia, Cordelia is a new worker. She just started 6 months ago, so she won't be counted towards the standard this year. But after this first year, if she continues only performing home visits, she'll need 4 home visit observations a year. And let's look at the answers for knowledge check 3. First, for Joyce. Because staff out all week was used, the weeks when Joyce was out on leave are excused from the count. Joyce isn't expected to have supervisions for those weeks. As such, she has 13 acceptable supervisions, at least 90 minutes long, out of 15, the new expected number. So she has 87%, which is over the 75% threshold. For Anya. So Anya's a half-time FSS. She still needs weekly supervisions. They just only need to be 60 minutes long. However, she does not have enough supervisions. She doesn't have any allowed excuses. Staff out all week was not entered. So she has 75 acceptable supervisions out of 25, which gives her 68%, which is less than the 75% requirement. Now let's take a moment to answer a new question. Pause and take a moment to list as many performance indicators as you can think of. Now let's review your list against the answers. Quarterly performance targets, retention rate, assessment timing, first home visit timing, required forms missing rate, accreditation required trainings, wraparound trainings, home visit rate, supervisor observations, prenatal enrollment rate, creative outreach rate, program capacity, and supervision rate.
Okay, in sessions 5 and 6, we will be tackling some of the changes in the best practice standards, and we'll take a look at them through the lens of a family resource specialist and a family support specialist. Thank you for completing session 4. Remember, if you have any questions, you can call. Here's the number, 518-591-8610, or you can submit a ticket through the support ticket on MIS on the home page. Now on to session 5. Thank you so much.
Thank you.